So you're going to laugh during this video because my husband, the professional photographer, is having a little bit of difficulty that we can't edit this film. So I hope you're entertained. So we're going to go back to introducing myself and verifying who my patient is. Hi, my name is Christine Balderas. I'm your SPTA. Danielle Balderas, correct?
Yes.
Nice to meet you. Tell me what brings you in today.
I've been training for a half marathon for, I don't know, a little over a month, and been running on the treadmill up to just 2 to 4 miles. And just in the last couple of weeks, I've noticed after running on the treadmill, my shins are just a little sore.
Okay.
Mostly on my right side.
Mostly on your right side. And when you say your shins, on your chart it told me it was your calf muscle. So is it both or is it one or the other? Can you point and show me where your soreness is?
Mostly the soreness could be just about right here, not too much on the calf at
Okay, all right, okay. And do you mind if I touch that?
Yeah.
Okay. So is it here that you feel it?
On both sides.
Okay, so both sides here?
Mm-hmm.
Okay. So I'm going to check your sensation on both sides. You're just going to tell me, does this feel the same on both sides?
Yeah.
Does one feel different than the other?
Nope.
Okay, and then how about on this side?
Feels the same.
Okay, so I'm checking her sensation along with making sure she doesn't have that acute hyperesthesia of acute pain, swelling, any of that, and it looks good. I don't see any open sores. I'm thinking in my head that, okay, I thought it was her calf, but now I know that it's in here. I'm probably going to change that sound head again, right, to a smaller one, just because we're by the bone there, and I really don't want to heat that up. So now I'm going to go back and talk to Danielle a little bit and make sure she doesn't have any of those contraindications. This is maybe where you're going to mark me off if I forget something. So we already know she doesn't have the hyperesthesia. Are you pregnant?
No.
Do you have any clots or recent surgeries where you know that you've had a clot thrown or any pain in your calf from that, anything like that? Good. And no cancers, no active cancers. No. And because we're going to massage that area too, no heart disease, atherosclerosis where you get the clotting of the arteries. No. No infection going on there, no varicose veins that I can see.
No.
And you don't have any issues with cerebrospinal fluid coming out of your spinal cord or anything like that.
Not that I'm aware.
Right. And let's make sure I check. I got them all, you guys. And you don't have a pacemaker, and we're not doing a total joint somewhere where there's cement or plastic components, so we don't really need to worry. We just need to know that we wouldn't do that if it was a total knee. We wouldn't do it around that area. She has no abscesses, and I think we know it's not an acute inflammation going on there. There's no warmness, touch. It looks good. It doesn't look red, so I think we're good to go. Thank you for going through that little tedious list. That's the hardest part. So what I would like to do today is I'm going to try some ultrasound on you. Have you ever had ultrasound before? Mm-hmm. Okay, so you know, because it's been a couple of weeks, I'm going to want to do more of a thermal effect with you, and that just means we want a little bit of heat. At no time should you feel uncomfortable burning type pain. So if you start to feel any numbness, burning, anything that's more than that gentle warmth, you're going to let me know right away, and we're going to either speed up the sound head or turn it down, or actually turn it off if it doesn't go away. And because we're going by a bony area, I really want to make sure you let me know that, okay? Mm-hmm. And it's not a big deal. We just adjust things a little bit, just so you know that's not a normal feeling, okay? And basically all that's going to do is provide some blood flow into that area to promote some healing, to try and get rid of some of that soreness that you're having. Does that sound good? Yeah. Okay, and then with the soft tissue mobilization, we'll follow up from the ultrasound with that the tissue should be nice and warm from the ultrasound, and I'm just going to go in there and I'll probably dig a little bit deeper to get some of those areas of maybe where the tissue is binding down from the running, and try and see if we can loosen some of those fibers up a little bit. Again, no numbness or tingling. I'll kind of check in with you to make sure the pressure that I'm giving you is okay. Do you have any questions with any of that? Are you okay with the treatment we planned for you? Great. Good. So I'm going to ask you to take your shoes off, and I think the best thing for you probably is just to lie face up on the table. So is underneath so you don't trip. There you go. And let me know if you need one more pillow or if that's comfortable for you. Okay. And now that I have her down there, I'm going to raise this up for my body mechanics. And she says it's fine, but she looks like she's a little bit down there. So I'm going to just ask her if one more pillow feels more comfortable, or if she prefers this She'll tell me which she likes better.
That's fine.
Are you sure?
Yeah.
Okay. All right. And it's the right side here, and that's the one thing when you're nervous and you have the camera and you're being filmed and tested, that sometimes you will do the wrong side. So always good to confirm this is where you're having your pain, so that you know two things: you're doing it on the correct side, and that you're palpating where you want to do that ultrasound for. So now with her, obviously these two sides is way too big of an area to be doing the ultrasound. So I'll find where she's point tender in here, concentrate on that, and then the soft tissue mobilization is when I'll do the whole area for her. Now Danielle, could you just lift your leg up? Good. And then I'm going to just bring this a little closer to me. I have all my things. Just bring it over to this side. And I'm still going to keep, and so now I might need to, let's see if this reaches. I don't want this to pull. I think we're fine. I'm going to just steal a stool from over here, conveniently, in case I decide I want to sit. How you doing there, Danielle? So where are you doing your half marathon at?
Napa.
In Napa. Oh, that sounds fun. How much longer training do you have?
Not long enough.
Not long enough, so we'll try and get you going, okay. And I know we talked about your shoes. Probably time to get a new pair of shoes. That's going to help with that soreness. So this knows that I just connected it, and it's not ready for me yet. So I'm going to check the B&R on this one. We'll just go ahead and turn this off until we get that hooked in. And so again, now I'm going to have to change, so I have to squint again. Now we have so this one was mismarked. This was one, so this really is a 2.5 centimeter squared sound head, and the B&R is 6. So we'll just remark that, because when they did this in the factory, they mismarked it, because we know this isn't 5. That was the last one we had, so sometimes we have to use our common sense. So I've replugged that in. I return on my machine. I'm going to set it there for a second where I look to see where she's most point tender. So with this sound head, we're just going to do an area about like this twice over. So we want the most tender spot.
Oh, right there.
Right there.
Down
okay.
a little. Yeah, right there.
Okay, and then would you say this is more tender than here?
On this side. Okay. No, the other side.
So this is
On the
where,
interior, yeah.
right, so this is where she's most tender. So that's where I'm going to do my ultrasound. I have two choices. I can put my sound gel right on it, but it's cold and that kind of makes them jump. So I usually, even though it's still going to be cold, I'm going to put it on my sound head, like so. And this is where you want to make sure this is closed all the way. Sometimes you're, if it's not, it's going to make this big mess when you go. Okay. And then I'm just going to first spread that. It's going to be cold, okay? And remember, we just want a gentle warmth when I go to turn this on. I'll let you know. And so right in here. Okay. So I just kind of move that around a little bit. I'm going to reset. I'm going to hit sound again. We're still a little debatable here with the deepness here. I think I'm still going to try and go a little bit deep. So I'm going to go 1. I am going to do 50% still. I'm definitely going to start at 0.5 with this, and we'll do this for 12 minutes. Okay. All right, so then I'm going to just sit down so I'm comfortable. And now I'm going to turn this on. You're going to let me know when you start to feel that warmth, okay? So I'm going to keep it at 0.5 for a second, just to make sure. And we're going to try and really focus on using just 2 times the sound head. Sometimes when we get distracted and we start talking to our patient, we go farther than we should, and then we would need to go for a longer time for it to be therapeutic. How's that feeling?
Feels fine.
No warmth?
Not really.
Okay, so I'm going to start turning it up, and you're going to let me know, okay? So I'm just going to kind of keep it moving here. Feeling anything yet?
Yeah, it's a little warmer.
Okay, not too warm?
No.
Okay, gentle warmth?
Yeah.
Okay. that comfortable for you?
Yeah.
Okay. So we're going to keep her at that. She's just at 1.0. Okay. At 50%. And so this is where I could talk to her a little bit about what things make it worse for you.
Just running.
Running, okay. Do you
Yeah.
feel it right away or after a few minutes?
Yeah,
Or-
mostly when I've like just kind of hopped off the treadmill.
So at the end of your run,
Yeah.
and that's after about
like 4 miles.
4 miles, okay, so like after a half hour, 40
Yeah.
minutes or so.
And I've pretty much only been running on the treadmill, and I've never done that.
Okay, and,
before.
yeah, and then do you leave the treadmill flat, or do you have it at a little bit of an
I
incline?
have it at the like 1.0 incline.
Okay, and then what makes it feel better, or how long, or does it not go away?
I just stretch and take a day off.
Okay.
And then
All right,
seems to be
and
fine.
using any ice or anything like that for it?
Yeah, I've been using an ice pack.
Good, and does that help a little bit?
Mhm.
And regular walking doesn't bother it?
No.
Okay. Going up and down stairs and
No.
anything like that? And you're doing some stretches, you said? What kind of stretching are you doing?
Just calf stretches and like some toe, what do you call that? Toe curls.
Toe curls? Okay, to strengthen those. Good, good job. Okay, so now we're just about done there. I'm gonna go ahead and turn that off. So I make sure and turn the intensity down if my timer hasn't gone off. And I hit stop. How'd that feel?
Yeah, good.
It's okay. So I'm going to use my towel, just use the tight end here. One thing I forgot to do at the beginning was to make sure we know that somebody's cleaned this off, but I always clean it off again just to make sure. So that would have been something I would have done different, and then I clean it off when I'm done too. So that way she sees that I do that as well. And then we're just going
I want my
to
money back.
turn that machine off. I could use this gel just for part of our soft tissue massage, or I could put the cream on there. So I think I'll probably just rub this in. But first off, so that nobody's tripping, I'm going to go ahead and unplug the machine. So I come over here, I'm not going to be yanking it, right? So we don't have those plugs. I use my good body mechanics. And we wrap that guy up, and we just stick him out of the way. So Danielle, one thing I forgot, which you didn't have any pain currently other than when I poked in there, right? And so what I should have asked her was on a scale of 0 to 10 what that pain was. Do you remember kind of?
Very low.
Very low, so on that 0 to 10.
Like a 2.
Like a 2, okay. And so for her, it's gonna be a little bit different just because her pain definitely is more when she's doing an activity and then it kind of goes away. So she came in here with a 2. I'm gonna just kind of poke in there. Did that change it any at all? Is it about the same, better or worse?
It doesn't feel quite as sensitive.
Okay, so a little less sensitive. Would you still give it that 2?
Mm-hmm.
Okay, and which we would think because we kind of cut the time short. We only did it for about a minute and a half. But so she knows it's a little less sensitive. So now I'm going to go ahead and do some soft tissue on you. So I'm going to raise the table up for me and stand because then I can use my body better. And have you had soft tissue mobilization before?
I think so.
And most people like it. So in the beginning, I'm going to just what we call effleurage. I'm just going to kind of assess your tissues a little bit, kind of what we were doing in the beginning there. There's a little too much of this on here, so I'm going to just wipe some of it off, okay? So I'm just going to kind of gently. And again, remember to let me know if there's anything uncomfortable while I'm doing this, okay? With this, because you're in an area that we know is sensitive, and I'm actually wanting to break that up when I start to go deeper, it's probably going to be a little bit sore. You doing okay with this? So I'm just kind of using my body and just kind of feeling what's there. So when we get to that point, we have that scale, that 1 to 10 scale. I'd like you to keep it somewhere around a 5 or a 6, okay? You can let me know if it gets unbearable. You've had this strip before in the past, I think, right?
Mm-hmm.
So that can get you up to that 9 or 10, which is okay as long as we put some ice and stuff afterward, and then it doesn't last longer than that day, okay? And then make sure you hydrate yourself really well. How are you doing?
Good.
So I'm going to check in with her a few times. I'm kind of just assessing as I'm doing this. I'm getting a little bit deeper, and I'm kind of using my middle finger right along the edge there. How are you doing with that?
Fine.
And she's saying fine. She's wincing a little bit when I get to this one spot right here, but not bad. So we kind of watch their face, watch to see if they start gripping their hands, that kind of stuff, if she decides to kick me or, you know, one of those kind of things. So I'm going to focus right in here a little bit. So I'm going to kind of come down here a little bit more. And I could do that one that Anthony showed us. How's that feel?
Yeah, that's good.
And that kind of gets right along that bone there for her. You okay?
Mhm.
And I could have her do some active movement with this. So we're going to push down. How's that okay?
Mhm.
And then come on back up. And push down. How you feeling with that?
Good.
And back down. And then I'm going to come out. I'm not going to ignore that other side even though it wasn't as tender. And I'd like you to push down. And come on back up. Good. And push down. And come on back up. Good job. And then I'm going to do a little bit of kneading in there. And now I realize that I should have had a little bit of lotion. I should have had this open. So Danielle, I'm just going to take my hand off of you for a second, okay? Not the end of the world, but not ideal. I'd probably get a point off for that. But you know, it wouldn't be a safety factor, so not to panic. And remember, we talked about just putting this on the top of us so that if we need more, we have it, okay? And be careful with your clothes. Okay, so I'm going to put a little bit on this because I felt like I was burning you a little bit, right?
A little bit.
Yeah, you're not a complainer, yeah. So you got to see that with your patient as well. And we talked about we don't want to put too much on because you want to be able to feel in there. You doing okay?
Mm-hmm.
So she really has some tight spots, so I'm going to work on that a little bit. I'm just using my thumb, but I'm keeping my thumb in a straight plane. I'm not having it come up here. I'm just using my body to sink in. You all right?
Yeah, that's good.
So with her, we're going to do something, it's a type of petrissage, but it's called stripping. So I'm just going to come in with my thumb on either side of her tibia and just kind of dig in there. You all right?
Mhm.
And I ask her to take some nice deep breaths while I'm doing that. And this is when Danielle's glad that I'm over 50 and you know have these big strong hands because it's fairly tolerable for her. Is that all right?
Mhm.
Good. What's that pain level at when I'm doing that?
Not bad at all.
Okay, so you're still around that 2 or that 3?
Yeah.
Good. And then I'm just going to come in, I'm going to kind of support with my other hand with that thumb. Now we're getting there a little bit. Now where are we at?
Just a little bit more like a 3-year-old.
Okay, so you can still tolerate that? Right in here I feel a spot, and she does too. So she didn't even know she had a spot up there, so. It might have behooved me to do her soft tissue massage first and work these really tight spots, and then I would know exactly where her ultrasound, so I might have changed my mind and did my ultrasound up here. But I'll know that for next time, so that's what I'm going to put in my assessment and my plan. I'm going to say trigger points mid-shin, follow up with do STM first next time, followed up by ultrasound to tender spots.
So does that mean I have to come back?
That means you have to come back. That means video number 2. Maybe we'll do the STM video on her with the ice, right? How you doing over here? Not nearly as bad. I don't feel those restrictions over here as much. And if we were in the real clinic, I'd probably work on her plantar fascia as well and probably flip her over and do her calf too, because a lot of times we know when the gastroc is tight, that's going to contribute to the shins. But I think her biggest issue is her shoes, and she needs to vary her surface every so often, not just do the treadmill. Yeah.
You can feel free to.
Yes, so we're going to go ahead and wrap this up. So I'm going to end up with some effleurage. Okay, so I do that nice and light. How's that feeling?
Great.
Awesome. And what would you say your pain is right now after we get done here?
Around a 3-ish.
So it's a little bit higher than when she came in, so we don't really want that. So one thing I might do with her is end up with an ice pack, and then you're going to learn about electrical stim next week, and that would be probably something I would do with her. I'd put her on that electrical stim and maybe some ice or maybe that squid, and I probably will do that with her. But before we turn off the camera, I'm going to lower the table. We're going to clean her off, make sure she's all good. I love that technique that Anthony gave us. Remember where he did like the heat at the end with the towel? Well, she doesn't like that so much. Let's see. He did it on her clothes, so maybe it's not as comfortable with this rough towel, but gets a little blood flow going in there. So we'll have to decide whether she likes that or not. Is it feeling better?
Yeah.
Right?
Yep, feels good.
It's a special type of massage. I can't remember how he trained Chinese medicine, so.
Yeah, I like it.
All right, okay, and she's got a little bit of red there now, so I'm gonna lower this table down and ask her to sit up and back up. And I'm here just in case. She's young, shouldn't be dizzy or any of that kind of stuff, but we never know, so we just always are there in case. We let her sit back down. We talked about the 3, now we've iced her afterwards, and so she's probably going to be a little bit numb from that. So at home, I want you to continue to do those towel scrunches. I want you to do the stretch we talked about, where you're doing the prayer stretch for that. You can go buy yourself a new pair of shoes, maybe beg your parents for help you out on that.
Sounds good.
Calf stretches, icing about every 15-20 minutes, about 3 or 4 times a day, usually about 2 hours in between. I think that's it. Do you have any questions for me?
No, I think that's it.
It was
Thank
such
you.
a pleasure to have you come in. Thank you so much for
Appreciate it.
volunteering. Okay, and then that's it.